And welcome back to Jeff Koinange Live. By the way, Jeff Koinange Live is powered by Johnny Walker. Johnny Walker exhibiting its eminence in electrifying quality and celebrating 200 years of blended Scotch excellence. By the way, I want you to help me out tonight by asking our experts the questions. What questions do you want answered? Everything from lockdown to vaccination to moving forward and how people cope. A lot of people are having a hard time. We know that. Everyone's having a hard time. But let's start right here with Dr. Mercy Mwangangi. She's the Chief Administrative Secretary at the Ministry of Health here in Kenya. Dr. Mercy, good to see you. I know you've had a pretty rough day, but before we get to your rough day, you just recently took the vaccine, didn't you? You got your shot. How was it? Describe it to us, please.
Yes, thank you, Jeff, for having me today. And yes, about 2 weeks ago, I did take my shot. And one, there was no pain. I think you must have seen pictures of me giving a thumbs up. It truly wasn't a difficult experience. And thereafter, I had the usual sort of mild side effects, a bit of a fever, a few chills, and, a Panadol was able to take care of that. And within no time, 1 to 2 days, I was back in action. So really encouraging Kenyans to come forward and take the vaccine.
And a lot of people have been very skeptical about that, Doctor. What do you tell them right now? What do you tell them? What's the message?
Right now, and I'd like to really echo the words of Waziri. When the vaccines came in, we essentially now have bullets, we now have grenades. We're at war, and that's what this vaccine is. And we're really excited today to demystify all the myths that are going around about the vaccine and to really encourage people to give them assurances that this vaccine is safe. I've taken it myself. I've encouraged my father, who's over 58 years old, to take it. So it's a vaccine that really, can save lives eventually. And so come forward. The vaccine is available. And, we'll be able to take you through, all the different materials that you require to know for you to make a choice in taking it. But I think our leaders have been able to give us examples. His Excellency took the vaccine, the First Lady took the vaccine, and CS Mutahi Kagwe has taken the vaccine. So we are welcoming all of you to come forward and take the vaccine.
I took the vaccine too, Dr. Eve, by the way, just FYI, and yes, quite painless. Let me get back to you. Hold that thought. Let me cross over to South Africa where we find Dr. Keith Shongwe. We know him better as Kim. He's founder, CEO, Health Cover PTY. Dr. Kim, have you been vaccinated yet down south? Where vaccines are in plenty. Have you been vaccinated yet?
Not yet, Jeff.
Whoa. And are you concerned? Are you worried? I thought health frontline workers were supposed to be given priority.
Absolutely. The program has begun the rollout. As you know, we've gone the route of J&J and looking at using the Pfizer vaccine as well as a backup vaccine. But yeah, I'm not concerned because I'm pretty sure that the program is in place and good to go.
Yeah, very patient of you. Dr. Kim, real quick, you guys, South Africa, were in what we say almost total lockdown for many, many months. And of course, the economy was affected. Every aspect of life was affected. Describe for us what a level 4, which is what you guys were at one point, what a level 4 lockdown feels like.
Well, firstly, when you open your windows at about 5 o'clock in the morning, you hear there's nothing. You don't hear anything. There are no cars on the road because there's a curfew, and that curfew basically restricts, any form of activity, transport other than essential services. And then you want to go to the shops, and you find that very few people are actually going to the shops for obvious reasons. And fortunately, the government managed to communicate the concept of, social distancing, wearing a mask, washing your hands quite effectively. So when we went, for example, if somebody was to go and do grocery shopping, there'll be social distancing. They limited the number of people who went into the supermarkets and so on and so forth. And I think that really that was the biggest thing that we felt as part of the of the lockdown.
Yeah, Dr. Kim, I'm going to come back to you, talk about whether we dropped our guard or not. Hold that thought as I cross over to Ibiza in Spain. Dr. Sally Correa, good to see you as always. First of all, have you been vaccinated out there in Spain?
Yes, I have been vaccinated. Good evening, Jeff, and thanks for having me. I've been vaccinated. I received the vaccine that my hospital was offering at the time, which at the time was the Pfizer vaccine. Europe hadn't fully approved the use, and so the health professionals got the Moderna or the Pfizer. Very few side effects, close to nothing. Recovery, there was really not much. Slight headache, which went away with paracetamol.
Okay, so you took the Pfizer vaccine, Dr. Sally, but there's a huge controversy when it comes to Europe and the AstraZeneca vaccine, which is the one we have in Kenya. What is the whole controversy? Just break it down for us, if you will.
Well, there are many facets to the sides of the controversy. So, starting from the very beginning, what countries did is they made sure they had secured enough in their orders. They had secured enough volumes of vaccine as the third phase 3 trials were coming out. So the main controversy, let's say the main problem that was the reason why France, which was the main country that actually halted Macron actually said that he would not be using them and then followed all the bigger countries, was a finding about formation of clots. So it was reported that there were 2 people, but just one woman apparently had a clot in her system, and out of 17 million cases, there were 22 thromboembolic events and 1 death. So what happened behind all this was that as normal procedure, it was halted, rollout was halted, and it needed to be analyzed. But when it was analyzed, it was found that, above all, these events of forming clots just happen spontaneously in the general population. And it was actually found, if you go down and you evaluate all the 3 different vaccines, that the events that were found with the AstraZeneca, for example, 25, the Pfizer had about 23, these were less than the actual formation of clots in the general population. So it was not related at all to any of the 3 vaccines. And that is where the conflict has come in. It's been proved that it has nothing to do with the vaccine itself, but that is exactly where the problem started.
Yeah, I'll get back to you in a moment on that, Dr. Sally, because there's still a lot of uncertainty and a lot of people in Europe who are saying, you know what, we don't want this particular one. But hold that thought. Let me come back to Dr. Mercy Mwangangi. Dr. Mercy, you know this story very well. I lost my first cousin today. I mean, Corona really hits home sometimes, or at times like this. And I'm going to ask the other doctors the same question. Because of the lockdown, was it because we had dropped our guard as a nation? Had we become too lackadaisical, if you will? Is that what's happened to us in the interim?
Jeff, let me begin by extending, of course, condolences to you and your family for that loss. Right now, I can tell you the cases of loss are all too familiar. All around us, I think everyone has experienced some type and form of loss. And so really, condolences to all the Kenyans who are struggling right now during this difficult period. When we look back and when we reflect, and this is a conversation that's very active within the ministry right now, what exactly went wrong? And particularly remembering that perhaps around January, February, we had very low positivity rates. I do remember people remarking, have we finally flattened the curve? And when we evaluate, the whole response, the whole COVID measure response, particularly looking at, citizen behavior, looking at our own behavior, looking at our own response measures, some of the lessons that we're picking out include one, that yes, indeed, there was a dropping of a guard. people became lethargic when it came to following the COVID restrictions. People stopped masking. People stopped washing hands. I can tell you assessments of hand washing points. You could see in the beginning there was a lot of enthusiasm when it came to setting up these points. Over time, the points became fewer, and when it came to social distancing, as we know, people were, meeting and grouping together. People were meeting together in the bars, having parties, and of course, the infamous political rallies that were there, in different parts of the country. So people were happy. People sort of jumped the gun and started celebrating, and sort of started living in a new normal without following these restrictions. And now, because of all these elements, we're now in the third wave, and I can tell you the situation is dire. Like I said, you losing your cousin, every single day we're struggling trying to find ICU beds for patients across the country, particularly in the high burden counties. And so the situation is dire, and that is why this lockdown is necessary. We've had the cries, we've seen the appeals from members of the public, but I can tell you, we were getting onto a dangerous point where our health system was now starting to become slightly overwhelmed, and that's why these measures were quite important to take into account.
Yeah, thanks so much for your kind words there, Dr. Mercy. But at the same time, the third wave swept in, is still in effect, and there are still people who don't believe that COVID-19 exists. You see people not wearing their masks, like you said. You see people socializing. I mean, what is it going to take is the simple question. What's it going to take?
I mean, and that's a very good question. That's sort of the silver bullet that we're looking for. And I'm quite encouraged by the situation in South Africa. He says that the government, noticed that people are really adhering to the measures, and there's been a lot of investments when it comes to behavioral communication and sort of mobilizing community champions. And really, that's the approach that we're taking on in Kenya. We've launched a massive campaign using different sort of champions in the community to really sensitize each and every member that, COVID is real and we do need to take care of ourselves. And already we're seeing some fruits. Particularly in Nairobi, I've seen, a little bit more of awareness. I can tell you, I've had a few people cancel events and functions and parties, and people are becoming a little bit more aware that the situation really is dire. What we're going to do going forward is really, use these champions such as yourself, Jeff, champions in the community, religious leaders, community health workers, and volunteers to really pump in this message. And perhaps also, it may be a grim approach, but it looks like it may be necessary to also share the insight of what it looks like in an ICU hospital. And we really do not want to get into a situation like Brazil and the other countries who had, numerous fatalities. But I can tell you, if we continue as we are, and as Waziri says, if we continue behaving normally, this will treat us abnormally. And already we are seeing the effects of this, particularly in our ICUs.
Absolutely. Dr. Mercy, hold that thought. Let me cross over back to Pretoria, South Africa. Dr. Kim Shongwe, let me just clarify a point I made earlier. South Africa is still under lockdown, let's face it, yes. But before you were at level 4, now you are at level 1. What is the difference? Please explain to us here.
Well, I think the decision that government took to move from level 4 to level 1 was I can appreciate a very difficult decision that they had to take, because they had to balance between opening the economy and ensuring that the vast people in the population, the majority of the people in the population, are safe and from the effects of COVID. The difference basically is that there's greater access at a level 1 as opposed to level 4. Level 4 was, as I said to you, quite tight. There were curfew hours. You couldn't travel between certain hours. And many restaurants, for example, were closed. And generally, places where people mixed socially were closed, but level 1 allows that to an extent. But it places a big burden on on not only government, but the healthcare system. So that's, I think, is a very and have to deal with how they balance the resources that are available and the decisions that they've taken.
And despite the lockdown, despite the measures taken by the government there, Dr. Kim, the variants that we're hearing about, especially the South African variant, that's more, I guess, virulent, for lack of a better word. Explain that to us, please.
Okay, so you cut there. You're talking about the so-called
South Africa variant, yeah, that's more virulent, that's easily transmissible.
Yeah, I wouldn't like to term it the SA variant. It's like the third wave, how do you define the third wave? In my view, the third wave is just what my colleague spoke about as the dropping of the guard. It's not an issue of a stronger virus that's, rearing its head. I just think that there's, we get to pandemic fatigue. And people tend to, forget to put a mask on. Social distancing, for example, you go to public places now where they used to say in the past, stand 2 meters apart. Now people are literally half a meter at best apart. So the third wave is, as I say, I think it's a dropping of the guard. The variant, I'm not an expert in this area, but I think that what you're seeing is a possible mutation. And I guess the next question you're going to ask me is, will the vaccine be able to cover somebody who now gets the third variant? And the answer I can give you is that I don't know.
Well, that's a pretty honest answer, Doctor. Hold that thought while I go to Dr. Sally Correa. And the numbers in Spain, Dr. Sally, have they been leveling off or are they still increasing?
So in Spain, we had a very aggressive, vicious third wave. It coincided with the same third wave in Italy and in the UK. And there was a certain point where all the European countries on the continent were losing there was an average of 700, 1,000 people per day, so it's per country. So it was quite frightening. The wave was very different from the first wave in the sense that we did see a lot younger people ending up in the ICU. And I want to emphasize slightly what was happening, for example, in Italy, because that's where I trained. And in Italy, where the situation right now is a lot worse than Spain, they also have had very many deaths, and it seems to be prolonging. But going back to the country where I'm living right now, we saw a very aggressive third wave. And because Spain didn't have a lot of movement of people, especially during the Christmas period, the kind of illness we had was localized to the country per se. Whereas northern Italy, for example, always has Milan and their cities that are always having a lot of traffic with flights. So what we do know is in Spain, our numbers are going down, yes. We've moved from very strict we're in a level 4, we've moved to level 3. It's getting better, but because we've opened up some areas of the country to foreign tourists, we've had our share of COVID fatigue and parties, and we've seen spikes in islands like Mallorca. We'll be expecting another spike in Madrid and Barcelona. So the wave was very aggressive, especially where I work in my hospital. The entire hospital and the gynecology ward, for example, was a COVID ward. Gynecologists had shifts in the COVID ward, which hadn't, it was a one-off on the last wave. So it really transformed our daily life. It's going down slightly, but we're hoping that the rollout will change things.
Yeah, we were all hoping that. Dr. Sally, you sound very optimistic in a country which has a very robust health system, a very robust economy, level 3 lockdown, and here we are. When you look across the pond, when you see Kenya in its first week of lockdown, and you can see the responses, the reactions. Of course, you can't compare Kenya's economy to Spain, but still, there are lots of similarities, and yet the responses are so different. What do you see when you look across the pond at us?
The hardcore kind of lockdown we had in Spain, which was that came in March, April, and May, was extremely intense. It was the kind of lockdown that you actually will. We had even mental issues because at a certain point you could not leave the house. England was a bit more flexible when they did come to the lockdown, but Spain was very intense. I think that kind of a lockdown where you can't leave the house, you have timing for everything, you can only go to the nearest supermarket, I think would be very difficult to carry out in Kenya because we're two totally different economies. It would be very difficult. I find that in Kenya, I did manage to travel just in that window. I was in Kenya in January, and I felt like being in it was a totally different setting. It was coming from an area where COVID was real, and coming to an area where you could still live and be careful, but we weren't in the situation we're getting into now. So I find that lockdowns, in the full-blown lockdown as would be in Europe, is very difficult, would be difficult to have in Kenya. And that's the reason why we must embrace continuing with all the protocols, and above all, the vaccine rollout will be the real solution for our country. Because our hospitals are not as, we don't have that many ICU beds. And in Spain, and I think it's even in France right now, the ICU beds are completely full. So I do feel that we need to prevent and we need to get the vaccination going as soon as we can.
Absolutely. Let me cross over to Dr. Sally Mwangangi. Maybe Dr. Dr. Mercy Mwangangi. Oh, too many names here. Look, Dr. Sally just said she came from a place where lockdown was lockdown. People followed rules. She comes to Kenya, and you see it every day. It's business as usual. It's like people, you know what? Life goes on. We're not taking this as seriously as we should, are we?
And I do agree with you, and your inference. And that's why the president had to take the measures that he put in place. We do not sit and enjoy locking down hotels and entertainment industries and the thriving element of this economy, in terms of people's livelihoods. Those were not easy decisions to take, but there were necessary decisions to be made. And if you happen to take a walk in our hospitals, if you look at both our public and private hospitals, if you are in a room with doctors, if you're in a room with policymakers at county and national level, you will then truly appreciate that the situation was dire. We've had conversations with county departments of health who have been looking for extra beds. My phone became a dispatch center for ICU beds. And I can tell you, it became almost nearly overwhelming for the health system. And so when Sally says that she came in and she noticed that people were still able to, live within a more comfortable lockdown or more comfortable restrictions, it begs the question on personal responsibility. The only way we're going to reverse and get back to, lesser de-escalated restrictions is if we see a picture where these figures are improving, if we see reduced admissions, if we see a reduction in positivity rates. And that can only happen if each and every Kenyan, particularly in the 5 counties, takes the steps that they need to take in terms of adhering to these measures. And really, it's that simple. If we all came together, for example, and purposed within the next 1 week, we're all going to adhere to these measures, I would definitely see a reduction in all those mattresses. So really at the end of the day, it might sound like a cliche, but it's all down to our individual efforts.
Yeah, easier said than done. Dr. Mercy, Dr. Kim, Dr. Sally, let's take a quick break. Come back, talk about vaccines. What's this we're hearing about the AstraZeneca vaccine being delayed in Kenya? And what's it like comparing Kenya with the other two countries? Which one is faring the best, the worst? And what are your questions? I'm sure you have a lot of questions. Help me out here. The experts are here. They're live. What questions would you like to ask them? Keep tweeting at Koinange Jeff, at Citizen TV Kenya, the hashtag JKLive. JKLive takes a break. We'll be back in a moment.